I am Dr. Saumitra, Director of Intervention Cardiology at AMRI Hospital, Dhakuria, Kolkata. Today, I'll talk about ambulatory blood pressure monitoring and its importance. Ambulatory blood pressure monitoring, or ABPM, provides a 24-hour account of the patient's state and is useful for diagnosing primary and secondary hypertension and differentiating it from the white coat and masked subtypes. It is accurate in predicting the risk of cardiovascular disease and mortality. Blood pressure level measurement using home or ambulatory blood pressure monitoring is recommended in patients with office blood pressure classified as high normal blood pressure or grade 1 hypertension, that is systolic pressure 130 to 159 millimeter mercury and or diastolic pressure 85 to 99 millimeter mercury. Ambulatory blood pressure monitoring provides the average of blood pressure readings over a definite period or a defined period, usually 24 hours. The device is typically programmed to record blood pressure at 15 to 30 minutes interval, and average blood pressure values are usually provided for daytime, nighttime, and 24 hours overall. A diary of the patient's activities and sleep time can also be recorded. A minimum of 70% usable blood pressure recordings are required for a valid ABPM measurement session. ABPM values are, on average, lower than office blood pressure values, and the diagnostic threshold for hypertension is 130 by 80 millimeter mercury or above over 24 hours, 135 by 85 millimeter mercury or above for the daytime average, and 120 by 70 millimeter mercury or above for the nighttime average, all equivalent to the office blood pressure of 140 by 90 millimeter mercury or above. The advantages of ambulatory blood pressure monitoring: number one, better predictor of hypertension-mediated organ damage than office blood pressure measurement. Second, 24-hour ambulatory blood pressure mean has been consistently shown to have a closer relationship with morbid or fatal events. Number three, more sensitive risk predictor than office blood pressure for cardiovascular outcomes such as coronary morbid or fatal events and stroke. Next, can identify white coat and masked hypertension. Fifthly, stronger prognostic evidence. Number six, nighttime reading. Number seven, measurement in real-life settings. Next, additional prognostic BP phenotypes. And lastly, abundant information from a single measurement session, including short-term blood pressure variability. But there are certain disadvantages, like it is expensive and sometimes limited availability, and also it can be uncomfortable for the patient. Ambulatory blood pressure monitoring has become an indispensable tool in the diagnosis and management of hypertension and its therapy. Recent guidelines from the European Society of Cardiology recommend that diagnosis of hypertension should be based on repeated office blood pressure measurement or ABPM if economically feasible. Analysis of various indices on the ABPM graph, such as hyperbaric index, diurnal index, dipping, and other indices, can provide useful information about the prognosis of disease such as hypertension, diabetes mellitus, CKD, and so on. It can also be used to monitor the therapeutic efficacy of the antihypertensive treatment. In addition, ambulatory blood pressure monitoring is the single most effective tool to diagnose white coat, masked, and nocturnal hypertension and can help direct the treatment in such patients when required. Overall, ABPM readings can guide towards the prognosis of underlying organ damage and can be a useful predictor of cardiovascular risk. You can refer to European Heart Journal 2018 volume for further knowledge about the role of ambulatory blood pressure monitoring and its usefulness in management of hypertension. Thank you.